Let's take a look at some incredibly rare genetic conditions and how they can impact both length of life and quality of life. Huge thanks to True Classic, our sponsor for this video. Let's get started. Beep-whoop.
In the suburbs of Buenos Aires, there's a young man whose reputation precedes him. 24-year-old Christian Fritz has Proteus syndrome, which causes parts of his skin, bone, and flesh to grow large and misshapen.
What's interesting about Proteus syndrome, it affects all three cell lines, which is endoderm, mesoderm, and ectoderm. So that means a lot of different tissues. In fact, all tissues that originate from these stem cell lines end up being impacted.
The same affliction, it's believed, that led Joseph Merrick to be known as the Elephant Man. There's still no cure for the condition, and Christian has endured great suffering because of it.
The issue with these genetic conditions is it's not as much treating whatever is on the outside, it's starting from the beginning and fixing the genetic problem, which is why we're hoping that a technology like CRISPR can be used for a condition like this that would otherwise be disabling or lethal at birth in many instances.
From the moment I gave birth, one of the doctors said that there was something wrong.
Her baby wasn't growing normally, and over the years, it just got worse and worse. His heavy limbs and massive tumors put a heavy burden on his hips and knees.
I can only walk about 50 feet without assistance.
Yeah, I was gonna say, I wonder if there's an orthopedic procedure, whether it's surgical or otherwise, that can help him with his functional limitations, because being able to walk freely and having independence is important in adulthood.
One of Christian's problems is that he has a normal heart, but in a body 3 times the size. There is an increased pressure on his heart, his kidneys, and his organs.
A lot of times in a condition like this, the blood vessels can also be impacted, thereby increasing the pressure the heart has to pump against, which then actually creates physical changes within the heart. And when the heart changes in a negative way like that, it becomes known as heart failure.
Doctors found that Christian's red blood cells were extremely low. They did a blood transfusion, which caused heart and kidney failure. Christian almost died.
It was the first time in my life I was scared.
A stint on the dialysis machine helped him recover, but it was a very close call.
I wonder if he was experiencing disseminated intravascular coagulation. Complex situation, and there's all sorts of things that can trigger it.
Today's checkup ends without any cause for alarm, and Christian couldn't be happier.
You only have one life, and it's too short to waste it by feeling bad.
It's great that he's found a community around his limitations. And we have to be honest and call them limitations, because I'm sure there are things he would like to do, run more freely, be able to walk great distances, and he has limitations, but that hasn't put a limitation on his ability to dream. He still has goals he set for himself, he has friendships, and that's what really matters, is setting yourself goals that are appropriate for you, but challenging enough for you so that it's still valuable once you achieve those goals.
Seeking a happy retirement, 60-year-old Ida and her husband Randy moved to Smithville years ago. There are places where everyone knows and cares for their neighbors.
A lady looked at me and said, "You should be ashamed of yourself being a woman and coming out in public with a hole like that in your head."
Is that a cancer? That looks like either a squamous cell carcinoma or basal cell carcinoma.
A malignant type of cancer consumed Ida's face. Now she hopes for a medical miracle. Ida's journey started over a decade ago.
I had a spot on my nose, and then years later, a pimple came up in that same area. And I squeezed it, but the hole just kept getting bigger.
So that's one of the most important things I tell my patients, and I've said it on this YouTube channel, that if you have a non-healing wound in the face, especially one that's growing, even if it's mild, you should speak to a doctor about it. Reason being is there's cancers like basal cell carcinoma, for example, can present itself in this way. And while basal cell is a slow-growing cancer, it's not one that usually spreads, it usually stays quite local. It can be greatly disfiguring, especially upon its removal.
And I was seeing a family doctor, and he was telling me to cleanse this wound with Dettol and water.
I hope there was a lawsuit involved here.
Ida has basal cell carcinoma. The condition afflicts more than 50,000 Canadians annually.
It's the most common type of skin cancer. What's interesting is there's actually a type of surgery called a Mohs procedure where they do a significant amount of reconstruction of the face when they remove a tumor. It's literally an art, the amount of change they could make to the face and still make it look similar to how it was before.
Doctors removed her right eye and socket, her nose, sinuses, forehead, and part of her skull that cradles her brain.
I was shocked at what I looked like. I was totally devastated.
A large skin graft surgically covered the hole left in Ida's face.
I'm not gonna lie, it seems like it's subpar care.
I didn't know it was coming. I had no idea that it was even ready.
Oh, facial prosthesis.
Ida's new face fulfilled a dream she's had for a long time.
My dream was to be able to have my face so I could look my husband straight in the eye and just tell him how much I love him and how much I appreciate how much he supported me throughout this last 4 years.
Pretty incredible what a difference it makes just to have this little piece of plastic on the face, but it makes a difference.
Ipu is a small remote community in the state of Ceará in northeastern Brazil. 50-year-old Luis Betzera da Silva has lived here all his life.
Oh, he has, look, appears some kind of warts, some verrucae on him.
Trabalhei muito na roça. Quando era mais novo, eu era mais melhor das mãos, né? Dos pés. Tudo eu sou da lavoura mesmo.
Viral warts are usually caused by the HPV virus, the virus that also can lead to cervical cancer, oral cancer at times. And that's why we very much recommend the HPV vaccine Gardasil to patients in certain age groups to prevent the likelihood, especially in the subtypes of HPV that can make someone prone to developing cervical cancer. And since the implementation, we've seen cervical cancer rates and cervical cancer death just absolutely plummet, in addition to things like screenings with pap smears.
For over 40 years, wart-like growths have been spreading over Lewis's body.
Does he have an immune predisposition to being susceptible to the HPV virus that most of us don't have?
Luis é portador de uma doença genética chamada
epidermoid dysplasia verruciformis.
There is no cure for EV.
And there's no specific dermatological treatments here that you can use to decrease the amount of wart formation to make it more comfortable for him to work and live.
But Dr. Gonçalves believes that by giving Luis regular boosts to his immune system, he will build up a resistance to the human papillomavirus.
I don't know if that's necessarily correct.
In up to 60% of cases of EV, the warts turn malignant and transform into skin cancers. Now back home, Lewis's biopsy results have confirmed that he does not have cancer.
With a condition like this, I believe that there's a very high risk of developing something known as squamous cell carcinoma. That's a very invasive type of skin cancer, and I believe individuals with this condition have like astronomically high rates. At some point in life, they will get it, sometimes in their 20s and 30s.
And as he is receiving regular boosters to his immune system, his warts are already starting to reduce in number.
I want to look at this about immune treatments for this condition. So there's topical treatments, there's oral medication like retinoids, interferon. Okay, so you could use interferon. You could use surgical, obviously, treatments. Protection from the sun, which is very important because they could speed up those malignant lesions we talked about. Yeah, see, I'm not seeing a lot of great evidence for using any kind of immune system treatments unless someone is specifically immunocompromised. Mostly preventive measures, which is unfortunate given that he lives in such a sunny area.
Graças a Deus eu cheguei até esse médico e me deu confiança, garantia, né?
I really wish they got him some surgical care here because I think with the correct surgical treatment, he would have significantly better quality of life.
Trini Amirwe had a normal birth and was a healthy baby. But at age 4, a benign bone tumor appeared on the right side of her face.
So the fact that it's benign is probably a good thing. The only issue is, will it affect any kind of anatomy in order for her to breathe properly, for her eyes to function, and also whether or not it's an ever-expanding tumor. Oof, see?
Her mother never imagined it would reach a massive 4.4 pounds.
And remember, this is growing outside of the body, so it's actually beneficial because it's not putting pressure on the internal structures of the brain.
Trini's mother is acutely aware of how her daughter is feeling.
Trini has a hope that one day, that thing will go off. She thinks that if this operation is done, she'll be fine, she'll look normal.
I mean, knowing the quality of plastic surgeons that exist these days, and given the fact that it's a benign bone tumor, perhaps there is a reasonable surgery to be had here. This looks like a type of fibrous dysplasia where fibrous tissue actually replaces the bone and starts growing in this abnormal way.
Doctors in Uganda tried to remove the tumor, but it only made it grow bigger and more frightening.
I'm worried about if she's not operated, it might eat her all up. The whole head might swell.
That's not an unreasonable concern because all it has to do is block off a vein, block off some vital structure, and it can create massive swelling from a lymphatic system component.
With Trini's medical records from Uganda, the doctors in the UK are able to diagnose her. She has a condition called fibrous dysplasia. There is no known cure for the disease.
Fibrous dysplasia is actually a very rare tumor of bone.
Even though it's rare, it usually only happens in a single bone.
Excising a 4.4-pound tumor is delicate and painstaking work. 4 months later, Trini and her mom are back in Uganda and filled with gratitude.
I wonder with fibrous dysplasia, if you remove so much tissue, does it eventually grow back and you need repeated surgeries? That I'm not sure about.
And she has big ambitions for the future.
When I grow up, I want to be a doctor.
Trini's bone tumor may grow back, but doctors from the Facing the World charity have committed to any future treatment.
You know, that reminds me of a story of a company that I actually donated to. We actually were able to give a sizable amount of money for a device that went into FDA trials that essentially acted like a cookie cutter for those with congenital nose and ear deformities. Normally, a surgeon would have to take some cartilage from the rib and then shape it into the replacement ear or nose. But this allowed you to just put the cartilage into the cookie cutter and press it, and you already have the predetermined shape there in different sizes to fit the patient's face. And it was a great way to be able to deliver care into areas where there weren't enough skilled surgeons to be able to do that type of procedure, and significantly shortened the amount of time required for that surgery. It was pretty amazing that we're able to do that. We actually have a whole video on that linked in the description.
Wynne, Arkansas is known as the city with a smile, and it's home to a woman who manages to smile against all the odds. Stephanie has harlequin ichthyosis, a rare genetic disease which causes her skin to be abnormally thick and severely cracked.
Yeah, this is a condition that only affects quality of life, but also can cause death very early on in life. Because remember, your skin is a vital organ that not only protects you from like an immune system component of protecting you from outside invaders, but also from an electrolyte balance standpoint. There's so much value to skin, and if there's issues like this, it can be problematic. Again, quality of life as well as length of life.
Survival rate at birth is 50%. As babies with the condition normally die within a few days through infection.
Yeah, I've seen the death rate be as high as 2/3.
Stephanie, at 23 years old, has survived to become the oldest living female in America with harlequin ichthyosis.
Wow.
But she's struggled her whole life with the condition. Constant protection is required.
I think it's like a barrier, pretty much is the best way I know how to describe it, to keep the germs out.
Yeah, it is a barrier, and it also helps keep moisture in.
I've always wanted to be a mom, but I didn't know if I could have kids.
I wonder if this condition impacts that.
The big fear was whether the skin on Stephanie's stomach would stretch as she grew bigger during pregnancy. A person with harlequin ichthyosis giving birth was unprecedented.
We talked to doctors, but they knew nothing. They couldn't tell us anything because I was the first one.
Yeah, the condition's so rare, and with most people losing quality of life and dying so early, sometimes it's hard when patients ask us questions and we just don't have evidence to fall back on. We can only speculate. And a lot of times our speculation is just a best guess off of the limited information that we know.
Stephanie became the first ever harlequin ichthyosis sufferer to give birth.
I wonder if she had to have a C-section.
She had a healthy baby boy, Willie, now aged 2. Followed by Olivia, aged 4 months. Neither child was born with harlequin ichthyosis, as both parents must have the genetic defect for it to be passed on to their children.
Pretty incredible. I mean, I wonder if both her parents had a trait for it, because otherwise she would have known that her parents had that. Did you know my actual identity is being stolen? I chronicled it here as well as got the scammers on the phone. Click here to check that out, and as always, stay happy and healthy.